Welcome to Nursing Research. This is our first week of the course, and here this week we're just going to be focused mainly on chapters 1 as well as chapters 2 of your textbook. I just want you to get a basic overview of what nursing research is, what evidence-based practice, or what we'll call EBP is, how they're similar, how they're different from each other, and kind of the basics of what a research article looks like. As far as your activities for this week, we're also going to be diving into clinical problems. So I want you to be thinking this week of things in your workplace or in clinical settings that you've been in recently that just don't seem right, or you think there might be a better way to go about doing it. My goal for you in this course is to, well, first of all, lose maybe some intimidation about research. I know for one, I was especially intimidated about nursing research as an undergrad. And it wasn't until grad school that it really, a light turned on for me and I got really excited about it. And I saw practical applications of research, and that's what really made me get excited about the whole topic. So I hope that you can gain a little bit of that enthusiasm, and at least your anxiety will be lessened, and that you'll be ready to take on the bigger nursing research course next semester. So like I said, this week we're just focusing on the basics of research versus EBP and then developing our own clinical problems. In essence, I want you to begin to think like Sherlock Holmes, who is always investigating, always asking questions, and trying to find solutions to issues. Side note, if you haven't seen BBC's Sherlock Holmes with Benedict Cumberbatch, it is an excellent miniseries. Okay, so you may have heard any one of these phrases either in your clinical rotation or in your workplace in the past. For example, that's the way we've always done it. Maybe you're wondering why nurses are always giving report at the nurse's station and they're not ever in the patient's room for report, where you think that that might be a better way to do things, or maybe you've heard of other hospitals doing it that way. And when you ask someone, they just say, well, that's the way we always done it. Why are we going to change now? As you may have seen, generally people and nurses are resistant to change. Or maybe you've heard it just makes sense. This could be even related to things such as diet and exercise that we're always trying to educate our patients on. And maybe it just makes sense to some people that we should all be on low carb diets because carbs, if not burned, can turn into fat, and we don't want fat, so let's just all avoid carbs, right? I know a lot of people talk about just not having pasta or breads or anything like that in the evenings, but is that really based in the literature? Is that really scientifically based? And is that really the best for our bodies? So something to explore. You might want to explore that on your own. Or maybe you've been told, or maybe you just have the understanding that, well, my preceptor taught me this way, so this is how we should do it. Next semester, you will be exploring the question of whether or not something as simple as should you inflate a Foley catheter balloon as a test before insertion. Maybe you were taught in your nursing program, if you were in one recently, that you shouldn't inflate the balloon for testing before insertion, but your preceptor taught you that you should. So again, these are all things that point us to looking at the research to see what the evidence is actually saying about it. So here's a very basic rundown of the differences between research and evidence-based practice. So research is basically when new knowledge is being generated. Someone wants to conduct a study, an experiment, to try something new that's never been done before, to see what happens, to see if that intervention is making something better. Whereas EBP is what we're going to be mostly focusing on, the process of EBP in this course and in your Nursing 360B next semester, your second part of nursing research, where basically you're going to be coming up with a problem, a question, a topic of sorts, and you're going to dive into the literature, meaning you're going to find research articles on that topic. You're going to learn how to read those articles, how to appraise those articles, which means not only make sense of them, but critique them, decide if they're well done studies, if they're well written studies and articles, and then you're going to apply that knowledge to practice. So based on what you've read and appraised, what recommendations would you make for nursing practice? So that's the EBP side. Research answers a research question or they come up with a hypothesis. In EBP, we dive into the literature based on a PICO question. It's kind of a funny word that you're going to get incredibly familiar with, but in nursing, we talk about PICO questions and when we're using the EBP process, and that's basically, we'll talk a lot more about that next week. You're going to read about it this week. It stands for population, intervention, comparison, and outcome, and it's just a way to form our focused clinical question that then frames the way we look at research and how we continue on with the EBP process. Okay, going back to the research side, research requires a research design, so you have to have a very clearly designed study with how you're going to collect data, what kind of intervention you're going to do, how you're going to analyze your data, all sorts of things that, again, we'll talk about next semester. In EBP, you don't necessarily have a research design, although it's a very similar idea. You just call it an implementation or a project plan. Again, this is something that you will be creating as a group in Nursing 360B, and then as an individual in your later courses throughout this program. It's basically where you take what you've learned from your research articles, you make a recommendation for practice, and then you apply that to practice. Finally, with research, studies must be approved by IRB. IRB stands for Institutional Review Board. So every major healthcare organization, university, etc. has an IRB. It's just basically a board of people that review all research protocols before studies can be implemented. And they're there to basically safeguard for ethical principles, making sure that the study is going to treat their subjects, which are people usually in healthcare studies, that they're going to treat them ethically, fairly, and take good care of them. When you're doing EBP implementation or project plans, you may or may not need approval by the IRB. One reason that you would not need approval is if your EBP project is nothing innovative at all. It's been done numerous times in the research, and so because it's not experimental or innovative, you wouldn't need to necessarily go through this strict process of making sure that it's ethical or that it treats patients well, because we can already see that in past research. This is my favorite visual of what essentially EBP is. So at the top we have current best evidence. This is what I've been referencing when I talk about the literature or when I talk about research articles. That is what evidence is. It's everything that we can find that's been done research-wise on a topic. But that is just one part of EBP. So it's a big part, but just one part is gathering relevant and solid research studies on your topic. Another part down on the bottom left is clinical expertise. So this is basically where you are, as a clinician, taking your own expertise into account when you're deciding on how to implement something in practice. Evidence says one thing, research articles say one thing, but maybe based on your own expertise in what goes on in your own clinical setting or with your clinical population, you may need to tweak that evidence to make it work from where you're at. And so that's a part of EBP. And then the final part in the bottom right is client-patient values. This is another essential part of EBP. It is not just taking what the research says and implementing exactly that. You're taking into account what you know about your setting and about your population, and you're taking into account the clients, the patients, their values, what they want. So to make sense of this, let me just give you a brief example of my own EBP project in my doctoral program. I went through a DMP program at Arizona State. And my background is in child and adolescent psychiatric mental health. And what I wanted to do was look at how to best treat childhood anxiety in an outpatient setting. So the current best evidence, when I did a literature review and found all the best articles on this topic, said that a combination of medication, so psychotropic medication and psychotherapy was the best way to treat childhood anxiety. However, when I took into account clinical expertise, it was incredibly hard to find, for one, good child and adolescent psychotherapists, And it was just hard in the practice that I was in. I was in a very busy outpatient psychiatric private practice. It was very hard to be able to schedule long visits, such as hour-long therapy visits. And then when I took into account client and patient values, my clients were parents who, a lot of them were very concerned about putting their young children on psychiatric medications. That's something that you run into a lot when you work with this population. And also, a lot of them could not afford lengthy psychotherapy visits that could go on for months and months, maybe even years. And so, taking all of that into account, I came up with an implementation plan, which was to implement a very shortened, brief psychotherapy program for these children in an outpatient setting. So now I want you to think about clinical problems that you may have run into in your own workplace, or if you're just coming out of school, maybe something you saw on a clinical rotation. I really want you to be inquisitive about your surroundings and constantly thinking of what could be done better or what's not going well. Just asking questions. This is where it all begins. So these are examples here of problems that have been presented in past courses of mine, either at the undergrad or the graduate level, because I also teach EBP at the graduate level at Point Loma. So one example that comes up a lot, and we talked about this earlier, is nurse handoff at the nurse's station. So you want to be thinking about, well, why is this the problem? Why is this the problem that we do handoffs at the nurse's station? Well, for one, it doesn't involve the patient, so it's not exactly patient-centered care. It doesn't involve the family either, if you're thinking about family-centered care. On a practical note, it doesn't offer you the chance to double-check lines with the next nurse. Which is a really important thing and can prevent medication errors and such. And then just be thinking about anything else, any other reasons why this is a problem. And then we have postpartum nurses not competent in neonatal palliative care. So a graduate student a few years ago did her project on this, where she worked in a antepartum, postpartum NICU department. And she ran into the problem where they had these unfortunate neonatal palliative care cases, and these babies basically didn't really need to be in the NICU medically, but they weren't going to live very long, and so they wanted to let them be in postpartum with their families there for whatever period of time they had left before they passed. And the problem was that these postpartum nurses did not feel comfortable taking these neonatal palliative care cases. And so this student, as an educator in this department, needed to develop some sort of an education program for these postpartum nurses so that they could feel competent in taking care of these neonatal palliative care babies. So problems with this issue is that families on the postpartum unit were not receiving the best education because the postpartum nurses were not appropriately educated. And in some cases, these postpartum nurses were even trying to reject taking care of these cases because, nothing horrible. They just didn't feel like they knew what they were doing or could offer the best care. So more ideas for clinical problems. Nurse burnout comes up a lot as a topic in this class. So what are some problems with nurse burnout? You can have low retention rates, high attrition, so lots of turnover in your units, right? Increased medical errors, so this could affect patients directly. Nurses are burned out and they're going to be rushed and not paying attention and have more medical errors. And I'm sure you can think of many more things that go along with nurse burnout, problems with nurse burnout. And then lastly, high fall rates, another major problem across lots of different facilities and settings. So what are problems related to high fall rates? Well, patients get injured. That's a problem, right? That affects not only patients, but that affects the organization. As many of you may know, organizations do not get reimbursed for patient stays when there are issues such as patient falls. So it's a financial issue. There you go. Hospitals may be penalized for this. Again, many more issues I'm sure that you could come up with related to high fall rates. So this is how I want you to be thinking about clinical problems, like just really diving into the details of why these things are issues. So finally, I just want to leave you with the basic steps of EBP and just let you know that this is what you're going to be doing. You're starting this in this course and you will continue forward in Nursing 360B next semester in these steps. So in this course, we're really just learning how to ask the right questions. I want you to ask a question about current practice. Next semester, we're going to dive into the evidence. You're going to begin searching for articles this semester, and then next semester, you're going to continue searching. You're going to find relevant articles on your topic, and you're going to learn how to read research articles and evaluate them, looking for how strong, how rigorous those studies are, and how relevant they are to your actual question. And then finally, you act. The final piece of EBP is taking what you've gathered and implementing that best evidence into your practice with patient care. So next semester in 360B, as a group, you will be developing a group topic, gathering literature on that topic, and coming up with a proposed plan for a practice change. You won't carry it out, but you'll have a proposal. And then in the following nursing courses and the rest of your time at Point Loma, you'll be doing the same sort of proposal plan on an individual level. So I hope that helps you get a good start this week. As always, please email, call, or text me if you have any questions, and just really have fun diving into this material in week 1.